Hey, I spoke about a PCP project we already have in our region. So we are running a project, it's a Horizon 2020 project that involves 3 different regions. So it's called Crane Project, essentially because it's a crane, a bird that is coming from the north of Europe to the south of Spain. We are representing the south of Spain, and we have the Norwegian and the Swedish partners in the project. And basically what we want is to build a model for managing health problems, essentially chronic diseases, to self-manage those diseases and to provide the access to the data to the user that actually is the owner of that data. I've seen that, for example, and actually it's my field of working. I see that research and innovation programs have evolved a lot after the pandemic, actually, because of the pandemic. Essentially because we as citizens, as a society, we realize that the research and innovation programs are really important for solving the problems and the pandemic and the threats all over the world appear. We need to solve that through research and innovation. Yes, I think we are now in the phase of having too many solutions, too many IT solutions, a lot in my opinion. I think we have trending technologies really nice, but the problem is the adoption. The problem is, we don't have the users completely ready for adopting that technology. So we need to work further in co-design with them all the different technologies we have, but for sure we are in a way that co-developing, co-design, co-working with the user, not only the patient, also the healthcare professional will solve that point. The next challenge we will face for sure will be how to manage all the huge amount of data we already are gathering for different gadgets, wearables, healthcare providers, users, yourself, as a patient, as a user, putting data in some platform. So the thing is how to explode that data in a really structured way and how to provide benefit to those that are providing data at the same time. So yeah, it's a real challenge how to, for example, for the healthcare providers, we have a huge amount of data because of the health journals, medical records, lab tests, waiting list, everything related to the healthcare system. But we are not investing in how to map those data, how to make this data, which is not structured, in a structured data and exploitable data. It's really difficult to address that issue, essentially because people are more and more concerned about their rights regarding the data. So what the use of the data will be. So for commercial purposes, for the public system or private system, and people are more concerned, but I think the regulations are really strict and really clear. But I think the problem and the challenge is actually how to communicate those regulations in Europe and in the different member states that are really clear, how to explain it to the users in order to avoid these concerns. Well, I think everything related with artificial intelligence is really exciting. So all the new technologies around machine learning, NPL, which is natural processing languages, and so on. I think it's really exciting and makes really opens a new paradigm about how to interact with the user, with the patients, with the healthcare professional, and how to take decisions. How to have a clinical decision support system for the healthcare professional in the way that probably we don't need anymore many medical doctors, and we need different profiles involved in the purely healthcare system. For sure, the networking. So first, new people, new ideas as well, new synergies, new ways of collaboration. Essentially, in these kind of events, you have more contact with the industry. So as a public system I work for, so we need more contact with the industry, and sometimes it's not really well seeing you interact with the industry before a tender, but in the end, when you publish a tender as a public system, you need to hear about the industry, what they can offer to you, because sometimes we ask for something which is really impossible, and I think attending these kind of events makes easier. Yeah, my health ecosystem in my region, in Extremadura, involves different entities. For sure, the healthcare system, also the social care system, though this system, which is focused on elderly, aging-friendly environments, nurses' home, daycare centers, and so on, but also research centers. One which is involved in minimal surgery, and also the health cluster, which is composed by different entities, different SMEs, and different companies in the healthcare sector. And the main objectives of the health ecosystem is to promote research and innovation in the region, in the healthcare system, to kind of promote also the interaction public-private for different projects. Yeah, I think ECH Alliance provides us a good environment for networking, makes us visible in these kind of events. It's a good partner, and also provides the basic environment, and at least people around to connect also with our own partners in the health ecosystem. So because we are always interacting, but sometimes using the network of the ECH Alliance, we can go further in webinars, or we can target more people when we are disseminating or communicating any of the activities in our health ecosystem.